name is Noemi Perez, and today I'm going to do my thoracic respiratory assessment on my patient. If this was a real life setting, I would have already collected my subjective data, my past medical history information on my patient. I would have already explained the procedure to her, gained her consent, answered any of her questions that she had into the procedure. She would have already been changed into a gown, and I would already have all my equipment gathered. First, I'm going to start off with the inspection of the posterior thorax. I'm checking for her muscles, bones, any curvature of the spine. I'm checking for any abnormal masses, lesions. I'm observing her accessory muscles while she's breathing. So I'm inspecting. Okay. Have you had any tenderness lately?
No.
Okay. Okay, so I have inspected her. My findings are normal skin. I didn't see any lesions or any rashes or anything like that. I didn't see any abnormal curvature of her spine. So everything looks great. So she was also breathing normal. So now I'm going to palpate for any tenderness. I'm going to palpate for temperature, for pain. I'm going to palpate her spine. So I'm going to check the temperature with the back of my hands bilaterally. Okay. And I'm also going to palpate on 5 on each side on her back. I'm just checking for any tenderness. Any tenderness?
No.
Okay. I'm checking her spine for any abnormal curvature. Okay. I'm checking for fermentalis. Every time I touch you on each side, I need you to repeat the phrase 99 to me, okay? I'm going to do this 8 times.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, so my findings are her fermentalis is symmetrical bilaterally. Okay, so now I'm going to assess for chest expansion. I'm going to put my hands like this, and I'm going to just check her for any chest expansion, rising. Breathe in, breathe out. Take a deep breath and breathe in. Take a deep breath and breathe in, please. Breathe out. Okay. Take a deep breath and breathe in and breathe out. Okay, so the movement is symmetrical bilateral. Okay, so now I'm going to go ahead and percuss. I'm just going to put my hand on her, and I'm going to tap and every spot that I touched earlier. I'm percussing for tone. I'm listening for renaissance. I'm going to do this 7 times. I'm listening for dullness and fullness. Okay, now I'm going to assess her lateral sides. I'm just assessing the lateral sides. Okay. Okay, so now I'm going to auscultate with my stethoscope. I'm going to clean my stethoscope, and I'm going to go ahead and listen to her lungs on the back. Every time I move my stethoscope, I need you to take a deep breath and deep breath out, okay?
Okay.
And this is going to be in a formation like this. Deep breath in, deep breath out. Okay, so my findings are normal breath sounds, no adventition sounds. I didn't hear any wheezing, crackling, or anything like that. So now I'm going to do her bilateral sides. Deep breath in, deep breath out. Deep breath in, deep breath out. Deep breath in, deep breath out. Okay, so she has normal posterior lung sounds and normal lateral lung sounds. They're clear to auscultation, no wheezing, no crackles, no stridor, nothing like that. So now I'm going to switch to the anterior thorax on the front. So I'm going to do everything that I did posteriorly. I'm going to start with inspection. I'm going to observe for accessory muscles when she's breathing. I'm looking at the skin, at her bones, her respiratory pattern. I'm looking at her external retractions, her positioning. I'm looking for anything that's abnormal to the eye. I'm going to be looking for barreling of the chest. So I'm going to inspect her now. I'm looking. Okay, so her breathing is normal. Her sternum is midline. There's no external retractions noted. Her skin is clear. There's no abnormal lesions. There's no skin tears. There's no rashes. Her skin tone looks even. There is no any type of tear or anything like that noted. So now I'm going to palpate. I'm going to palpate for any tenderness, for pain, for lumps, sensation. I'm going to palpate her muscle development. I'm going to be looking for fermentus and crementus. So I'm going to use the pads of my fingers, and I'm going to do a circular motion. And this is going to be 4 spots on each side. Any tenderness lately?
No.
No tenderness?
No.
No pain? Okay, so she hasn't had any tenderness or pain. Her temperature felt, let me check her temperature actually. I'm just checking the temperature with the back of my palm. Okay, her temperature is normal for her body. It's warm to the touch. It's not cold and clammy. It's no sweating or anything like that. So everything seems normal. No masses. I didn't feel no masses noted on her when I was feeling for the temperature. I didn't feel any abnormal findings on her while I was palpating. So now I'm going to be checking for fermentus at each spot. Again, she's going to say 99 when I touch each spot, and this is going to be 8 times. It's going to be on 4 on each side.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, so interior fermentus is symmetrical. Her skin is normal. There's no abnormal findings, no abnormal vibrations. So now I'm going to check for chest expansions. I'm going to put my hands like this, and I'm going to ask her to take a deep breath in and deep breath out 2 times. Deep breath in, deep breath out. Deep breath in, deep breath out. Okay, so her chest expansion is equal bilateral. I didn't feel any abnormal vibrations in there when she was breathing. So now I'm gonna go ahead and percuss the chest. I'm gonna do this in the 5 spots. I'm gonna start at the top and go down. I'm checking for resonance, dullness, fullness, any abnormal vibrations. Okay, so I didn't feel any abnormal vibrations. Everything sounded good. There was no abnormal sounds. I was checking for fullness and dullness. So now I'm going to auscultate with my stethoscope. I'm going to auscultate for breath sounds. I'm checking for any adventitious breath sounds such as wheezing, growls, crackles, stridor, anything abnormal in the lungs. And I'm going to check this in the pattern again of the 4 spots on each side, so 8 spots altogether. And I'm going to clean my pad with the alcohol pad, and I'm going to listen. Every time I move my stethoscope, I need you to take a deep breath in and deep breath out, okay? Deep breath in, deep breath out, deep breath in, deep breath out. Okay, so my findings are her lungs sound clear to auscultation. There is no adventurous breath sounds noted, no wheezing, no crackling, no rails, nothing in that sort of nature. So everything seems fine. My patient seems healthy, and that concludes my video. Thank you.